everyone, myself Virenjan Kumar. I am physio student. So आज हम देखेंगे एक new question which is have come in our practical exam of electrotherapy. So the question is: patient having complaint of burning pain and tingling on a sole of a right foot and a big toe from 4 months. Assess the patient and diagnose via EMG with diagram. So the question has told us the patient have burning pain or tingling on a right sole. So there is a patient who have suffering from pain or a tingling on a sole of right foot and a big toe for a month, and with the help of EMG, we can diagnose the what kind of pain and what they can suffer will be like a treatment protocol. What can I can develop on the patient. So first, what I can write in this answer, like assessment and diagnosis using of EMG. As I can see here, EMG is written. EMG, it means electromyography. What is the meaning of electromyography? Like electrical signal. Myo means skeletal muscle and graphical representation of the signals who have neurologically and like stimulating passes from the skeletal muscle on the screen of EMG. So patient demographic name, here the name is not written, but I can take one example. Mr. Rakesh. Age will be not written, also taken 45 years, gender male, and occupation office worker. Chief complaint burning pain, tingling on a sole and a toe, as you can written here. Duration of the symptoms 4 months. Onset gradual, not sudden. Progression worsening on the prolonged standing, and the dominated side, it will be right side. So it is a demographic. What is the subjective assessment? Like history of present illness, patient report burning, tingling and numbness in a sole and a big toe with right foot. Symptoms increase with standing, walking and wearing tight shoe and reduce on a rest. Like that, a patient like standing and like walking some steps, like walking on a like ladder on a escalator or like elevator. They have like a pain on that foot or sole, or like as there is a shoe they have wearing, they can have it tight while walking or running, and they can again feel pain and arise on the foot. So there is no history of trauma, there is no any kind of like accident or like trauma or injury, like it will be happen like gradually without any trauma. So no history of trauma or infection or systemic illness reported. There is a VAS, like visual analog scale, it is to be 6 comparatively 10. So it is like pain rating scale. What is the pain? Like if I am saying about 1 to 10, how much pain the patient will be feel? So patient will be say about that I'm feeling pain like 6. So I can put here 6 out of 10. So post medical history, so no history of diabetes, mellitus or peripheral vascular disease. So if patient have suffering from sole pain and tingling on a sole, so there is a chances for diabetes, so they can help like in enhancement in the diabetic foot. There is a symptoms of cause, and there is a other chance of the peripheral vascular disease. There is a varicose vein and web of the like vein, so there is a chances of to increase the tingling and like burning on a sole. So patient goal, what the goal of the patient? First, relieve the burning pain and tingling in from walking. So first, patient have burning of pain. So they have what I physiotherapists have goal first: reduce the pain, reduce the tingling, and secondary thing is improve the walking. So what is the objective assessment? The gait. Gait is mild and talgic on the right side. It means they have to shift their weight on a left leg, and they are not fully like forcefully touches the ground of their right leg. They are totally transfer their weight on the left leg. Posture will be normal. There is no connection of the pain in the posture. No swelling, no redness or deformity observed on the foot. Palpation, mild tenderness on the medial aspect of the right ankle. If I am touches on the ankle joint of the right, there is a mild tenderness, like feeling pain while touching of the therapist or like doctor. So what is their range of motion? Ankle dorsiflexion, full right, full left happen. Ankle plantar flexion, like slight discomfort. Plantar flexion will be right leg will be slight discomfort, or full toes flexion or extension normal and normal. Like plantar flexion will be slightly discomfort on the patient. The muscle strength will be tibialis anterior is 4 to 5, like pain. Abductor hallucis longus is 4 to 5, have a pain. Like other foot muscle 5 to 5, have no pain. Other muscle like tibialis posterior and abductor hallucis longus is to be having a pain on that muscle. So there is a 4 rating. What is their sensation? Decrease sensation to right touches and prick on the medial plantar aspect of the foot or a big toe. If I prick the pin on their right foot, they have a increased their tingling and sensation on the foot of a patient. So there is a chances of tibialis posterior abductor hallucis longus nerve innervated or like there and kind of like like ankle twitching or like stiffness on their place. So there is a rising of the tingling sensation of the right sole. What is the reflexes? Like ankle jerk, normal. Plantar reflex, normal. So now we can do some test on the patient. Tinal signs, positive. Suggests tibial nerve irritation. There is a test. We can perform the patient. There is a positive. And tibial nerve irritation. So it is a test performed by the therapist on a patient. So patient have like complain about that. If I'm doing like tinal sign, there is a irritation of the tibial nerve. So we can identify that the muscle of the supply of the tibial is posterior, or there's a supply by the nerve of the tibialis nerve. It cause the irritation of that. So as a test we can do negative. So rule out lumbar radiography not be happen. Assessment, provisional diagnosis, right tarsal tunnel syndrome will be happen. Differential diagnosis, peripheral neuropathy, lumbar radiography, plantar fasciitis will be not happen. Plan and care, plan of the care. Short-term goal, what is that? Reduce burning and tingling sensation on the patient, relieve pain and tenderness on the patient, educate a foot wear and the posture modification. Like reduce burning and tingling sensation, it is a short-term goal. First, we can do on that thing for providing like stretching, strengthening, like provide a hot pack or like rehabilitation technique. Relieve pain and tenderness, reduce the tenderness of the or the pain. If I am touches over there and they have patient complaining about that I have pain, so I have focusing first to like reduce the tenderness of that place. Educate the footwear and posture modification. If patient have shifted their weight on the left leg, so we can correct on them and told him don't shifted their weight on a single foot. They can and also wear a proper size of footwear for the proper walking. What is the long-term goal? Improve nerve conduction or a foot strength. We can enhance their strengthening of the foot and also enhance their walking and function activities. They can walk, run, and also easy to wear shoes, and also their walking and running activity they can perform easily. Prevent reoccurrence of the symptoms. It means there is a next time will be not happen again the same symptoms on the patient. We can enhance their capability and induce their power. They can we can also help in some strengthening and stretching technique to tell the patient they can implement and use their in a regular work or in a home. What I can saw that the EMG diagnosis, the finding the consistent with the partial tibial nerve interruption at the tarsal tunnel. So right side of the tarsal tunnel there is a tarsal tunnel syndrome just because of the tibial nerve irritation will be happen. No evidence of proximal nerve root lesion or general neuropathy. There is no any kind of lesion, there is no any kind of neuropathy will happen on that place because there is no any kind of trauma of the patient. So there is only kind of nerve irritation. So what is I can show on the EMG machine of the nerve. So EMG machine show that what kind of there's a two type of electrode, surface electrode or like needle electrode. So we can use needle electrode for why you use needle electrode for so that each and every muscle are like innervated, denervated. Which muscle is like having arise their pain, like they arise their twitching or like cramping or like nerve irritation. So each and every specific nerve we can use the needle electron or a single wire electron for help them. So what is the result? Results are I have taken about some parameters, normal value, patient value, or in interpretation. So what is that? So first, tibial nerve distal latency. So normal value is greater than 6.0 meter second. So, what is that? Patient is 8.2 per meter second. The prolonged suggested nerve interruption. It means the patient have suffering from more pain in the tibial distal nerve latency. Tibial nerve amplitude. I have taken from that. So there is a reduce of 4 megawatt, and the patient value is 2.0 megawatt. It reduces partial axonal loss. It means if the patient is like laying on a bed, the symptoms or severity will be reduced down. Conduction velocity. It is a normal value is lesser than 40 meter per second. Minute per second. What is the patient value is 30 minute per second. The capacity decrease demyelination. It means like patient have complaining about that the severity of the tingling and burning sensation will be like increased in a way, or if they're increased, the myelin sheath of the neuron will be decreased their resistivity, and like tingling and sensation will be enhanced. EMG of adductor hallucis longus. So there is no any kind of irritation on that muscle. So normal activity, debilitated patient will be potentially present or mild denervated. Because of that, some irritation occur in like tibial nerve. So there is a compensatory compensatory will be sent into them into like tibial nerve. Here you can see there is a right sole and big toe. So there is a EMG machine, and here I can check we can use force signals, and the first we can at the minus 2000 degree have sent the signals. There is like present the graph in 2000 degree. They will be reduced the session one, and another session will be taken. There is no any kind of implementation or reduction of their like irritation will be happen again in session two. What is their session three? Session three will be again will be not happen again like pain or tingling sensation or burning sensation on during the treatment period or prognosis period. And again the session 4 or 5, there is current will be induced and patient will be walk again independently, and the patient no any kind of interaction, no any kind of like walking pain or tingling sensation will occur. So in session 1 there is a graph will be like severity will be happen and no contractility will be shown, that just because that they have long standing period, just because that in tibial nerve will be pain arising of that. So that is the question. I guess you have understand about that. Thank you.